recording.
Hello, welcome to Heartland Family Services training on gambling in the workplace. We really want to take this time to talk to you a little bit as employers on different ways that gambling can impact the work that you are doing and impact the people that work with you. So hopefully we'll spend a little bit of time today talking about why and what is problem gambling, what does it look like, and how it becomes a problem. Understanding why gambling at work can have negative consequences and ways to identify what those consequences are. And then also recognizing what agencies can do to develop policy regarding gambling and other substance use at work. So first, talking a little bit about Heartland Family Services problem gambling program. We are contracted through previously known as Iowa Department of Public Health, and now it's Iowa Health and Human Services, to provide these services into the community. And that includes both treatment and prevention. Prevention is the work that we're doing today, talking to the community about gambling and how it can become a problem, different things that we can do to prevent it from becoming a problem in our community. And then the treatment side is working with people who've identified as gambling as a problem in their lives and figuring out a way to get them the help that they need. And this can be done through first an evaluation and then creating a treatment plan to help that individual overcome the obstacles. One of the unique things about this program is that not only do we work with the individual who is identified as having a gambling problem, but also their family and concerned others. So this is kind of a unique way to approach the addiction. So if we take a little bit of time and identify what is gambling, we tend to use kind of a really generic definition of gambling and saying that gambling is really the act of betting something of value on an unknown outcome. And I'll talk a little bit more why we have kind of a broad definition of that and how different types of activities could fit under that definition. So then when we talk about an individual who has a problem gambling, this is the person who is gambling and it's causing some type of problem in their life. It's impacting their mental health, it's impacting their finances, it's impacting the relationships, and possibly the work that they're doing. So one of the reasons why we have a very broad definition of gambling is that we really want to let people know that you don't specifically need a casino to gamble. There are a lot of different ways that people participate in gambling activities. Some of them we carry it around with us, a cell phone. There's a lot of different games that people are playing on their phones that kind of go into the lines of gambling. Sports betting in Iowa has become a pretty big activity, and we'll talk a little bit more about how big that has become. At work, we often do office pools and a lot of different activities around unknown outcomes of pregnancy or sporting events, other types of ways that could be seen as team building. And then March Madness and brackets is another kind of popular one to do. So how much are Iowans spending on gambling? So some of these statistics that I've pulled are national statistics and some of them are Iowa specific statistics, but I think it really goes to show how big of a problem this is in our society as well as in our community. So when we look at Super Bowl and March Madness, Super Bowl is 16 billion, and that is with a B, billion, and March Madness as 3.1 billion. So we can drill down just a little bit more and look at specifically Iowa and how much Iowa is participating in sports betting, and not down to what those two events are, but looking at the lower middle box, we have some Iowa 2022 numbers, and throughout the whole year of 2022, Iowans placed $2 billion on sports betting. This is not the casinos. This is not lottery. This is exclusively sports betting. And then if we're going to kind of attach it to the Super Bowl, just in December of 2022, $266 million were bet. And so what that number comes out to is about $8.5 million a day that Iowans have placed on gambling. So while maybe an average person isn't able to recognize that people are gambling, these numbers show that a large number of people are gambling at some level. And so just knowing that that number is pretty large, very likely somebody who's sitting next to us or somebody that we know is participating in these activities. If we look at the Iowa Lottery, Iowa Lottery does a really good job of publishing what their numbers are. In 2022, $432 million were Iowa Lottery, so that's scratch tickets, Powerball activities, and specifically Potawatomi County is 14 million. Let us know if you have other counties. We can drill down to specific counties and let you know how much has been placed in each, how much gambling has been done in each of those counties. And then Candy Crush, I threw that in there, and sometimes people may wonder why Candy Crush is on here. If we look at Candy Crush, the game, I tend to pick on it because we all are familiar with it. It's been around for a while. It's a game that multiple generations have played, and it is still pretty popular. This number is a couple months old, but it's a United States number, but $607 million were placed on Candy Crush. So again, not just going into the casinos, not just lottery activities, but also activities that people are doing on their phones. So who's doing this? In Iowa, who is gambling? The statistics show that about 88% of our community gambled in the past year, which is a large number. And of those, about 3% have developed a problem with gambling in their lives. One of the bigger numbers is that 1 out of 5 individuals have been affected by someone else's gambling problem, which I think it's important to talk about. And I think it's also important why Heartland Family Service provides significant other therapy as well, because it's not just impacting the individual with the gambling problem, it's impacting a lot of different people. We have not found any gender, age, financial background. Everyone has equal opportunity to develop a problem with gambling. There's not one specific group that is immune to it.
I think one of the things that is noteworthy here, at least I think, when I talk about problem gambling and say 3% of people develop a problem, people tend to think that's not a big deal. Like it's only 3%, right? But if you take like Greater Omaha, Council Bluffs area of, let's say 400,000 people, 3% of that is 12,000 people. So there are still 12,000 people in the metro area. And if you include Council Bluffs, in that greater metro area, I don't know what that population is off the top of my head, but 12,000 people is a lot of people that really significantly have a problem with gambling. And so even though it's 3% and it doesn't sound like a big deal, it is, when you break it down in our metro area.
I think we're closer to 1 million, so double that number that you just shared, closer to 24,000 people. Yeah.
For like Greater Omaha, Greater Council Bluffs metro area. Yeah.
Correct.
Perfect.
So how does gambling become a problem? We saw that 88% of a population has been gambling in the past year. However, 3% have developed a problem. So we know that the vast majority of people are able to participate in gambling activities without it impacting their life in a negative way. There are some factors that elevate that risk of it becoming a problem in your life. So if you are using gambling to escape stress, emotional pain, concerns or stresses at home or at work, all of those things make our likelihood of developing a problem higher. If an individual has lower self-esteem or they're kind of lonely, they don't have a great network of people, that also increases their likelihood of developing a problem. If somebody likes action and are really competitive and are really into sports, that can also elevate that risk. We do know that the younger people are exposed to gambling, the higher their likelihood of developing an addiction. So we really want to make sure that our young people are not participating in gambling activities until the legal age of 21. If there's a family history of addiction, any kind of addiction, we have a higher risk of developing a gambling problem. And then also if the individual's ever had trauma in their life, that could be current abuse, past abuse, all of those things have an impact. When we look at gambling addiction, we oftentimes compare it to substance use addiction, and there are a lot of similarities, and those are listed on this screen. Oh, I do want to spend a little bit of time to talk about the differences, because I think we are as a society a little bit more similar or familiar with addiction and how those things can look alike. One of the there are a few things that make gambling just a little bit trickier and hidden, and that is there's nothing that we're consuming. And I think it can also be confusing how we are becoming addicted to something that we're not physically putting into our bodies. Along those lines, because there's not something we're physically not putting into our bodies, there's not as much visible damage to our body. Not to say that there's not damage to the body for somebody who has been gambling over a period of time. It's harder to see it though. Oftentimes when somebody's impaired, we can identify those things on the outside. You can't test if somebody has a gambling addiction. So that's also kind of hard. We can't, look into somebody's eyes and probably say, oh, you've been out gambling. It is truly a hidden addiction. The way that we can come at it is identifying if an individual has financial problems. However, in the Midwest, we are kind of taught that finances is not a polite conversation. So that is also a barrier to identifying if somebody is struggling. We're really there's no set guidelines on what is safe levels of gambling. I think that science is starting to kind of come up with some parameters around that, but we really don't know that you can have 1 drink per hour and consider that to be a safe usage or a lower risk usage. And not as many people are talking about gambling. There's not as many prevention efforts going on, and treatment options are also limited. So how do we know? So I just said that this is hidden. How would we know that there's somebody who is struggling with gambling that we work with? There are probably some pretty good indicators about work performance and a decrease in the quality of work that the individual is putting out. Oftentimes we'll see that this person is really preoccupied. They're thinking about gambling a lot. They're thinking about when they're going to be able to gamble again. They're thinking about how they're going to come up with the funds to continue gambling, possibly thinking about past gambling activities and how they're going to kind of work through those. So that leads to, harder time concentrating. An individual can be late or absent, and this could include long or, lunch breaks, or coming in late, coming in tired, leaving the work early. All of those things could be indicators that an individual is struggling with gambling. We talk about the finances, asking for advances on paychecks, asking coworkers to borrow money, possibly having disagreements with coworkers if money had been borrowed in the past, and how they're going to, pay that back. Maybe some conversation about stresses about mounting debt and the burden and the stress of all of that kind of coming at them. Possibly using a phone for personal calls. With sports betting, they might be using work time to research which teams to bet on, placing those bets. All of those things can happen during work hours. March Madness, we talk a lot about how much time is used at work watching the games. Productivity goes down a lot in the month of March. Also, kind of being emotional or having mood swings tied towards their winning and losing. We've heard of some people having credit card statements or other bank statements mailed to work to avoid somebody at home seeing those. And also, on extreme case, fraud, whether that can be an embezzlement or even on a smaller scale, making false claims on expense accounts or other ways to take money from the organization or the business. There are a couple cases locally where we have seen a significant amount of embezzlement happen, and it was directly tied to a local casino or local gambling activities. The first one, the quote from this individual is $2,500 at a time, maybe $5,000 a month. I never kept track of it. When they came up with a figure of $340,000, I literally was sick. I was obsessed about gambling and about covering it up. So this was from a bookkeeper out of the metro area who was found guilty for theft a few years ago. And the other one was quite a bit larger. $4.1 million was embezzled from the company, and they were able to tie the exact dollar amount that went to Ameristar Casino. One of the kind of unique things about this one is this business decided not to press charges against the employer, but they tried to press charges against the casino, saying that they should have known that a bookkeeper wouldn't have had $4.1 million to spend at a casino. So again, when we're looking at our business and how do we protect our employees and how do we protect our business, these are some examples of, were there warning signs? I'm not sure, but at $4.1 million, it's an extreme case of embezzlement. So we don't have casinos at our work, probably. There's no slot machines, and maybe there's no lottery vendor there. There are a lot of different ways that we are gambling at work, and maybe we don't think about it because it's just become normalized. We oftentimes think about these activities as team building, just kind of a fun way to blow off steam. However, we really need to think about it in a more thoughtful approach, because we usually don't offer beer at work, and how that can be triggering to somebody who has a addiction to alcohol. The same thing for gambling activities. It's insensitive to offer these company team building events when it could be a trigger, it could really be hurting somebody. So just being aware of the activities that we're doing, making sure that they're safe for everybody, as well as protecting our business. So sports brackets, it's not uncommon to have fantasy football teams, clubs, March Madness brackets going around the office as a pool. I've seen a lot of, when is the baby coming? As we have a expecting coworker, is it a boy or is it a girl? What's the date? All of those things can be wagered on. Sometimes gifting people lottery tickets as fun birthday gifts or incentives through work, groups going together to purchase lottery tickets, and encouraging or hosting activities at casinos or having casino nights. All of those things just as a way to kind of think about what we're doing and being sensitive to everybody who is in our workforce. So what can we do as businesses? One, we can be aware. Gambling is a problem in our community. Gambling could be something that our employers are struggling with. And we can also kind of work through some policies that protect our business as well as our employees. Um, I think that having some of those activities kind of puts us at risk as a business. So one of the things that Heartland Family Service has is a response as a gambling in the workplace toolkit. And our prevention staff is able to come and work with your business on developing a policy. And some of the steps that we would take or help you through is one, kind of looking at the risk and looking at your specific business and identifying if these are some things that could possibly be happening in your place. Um, Two, you can provide the information that is given to you in this toolkit to your employees as a way to educate them and bring awareness about gambling and how gambling can impact our lives in a negative way. Continuously communicating with employees about gambling and also what the resources in the community are if they are experiencing problems or if they know someone who is experiencing problems, where they can get help. And then the last one is to develop a policy on gambling in your workplace. And that's specifically prohibiting those types of activities from happening. And if they do, then the business has a plan in place on how do we address this? How do we help this individual get the help that they need and hopefully be able to stay employed with your company? So this is just a quick look at what's in the toolkit. This is a little bit of the outside. There's sample policies in the toolkit, and the prevention specialists are able to really work with you if that policy and adjusting that policy to make it work for your needs. There are different one-pagers which include ways to educate your employees about gambling and how gambling can be a problem. We can offer training, and the PowerPoint presentation, which can be adjusted, is also a sample of that is in there. There's some posters that can be put out within your organization or your business, and then talking points. And as a general population, it is hard to kind of have these conversations. So this is a good way to encourage you to start the conversation and do it in a way that is sensitive to everybody who is involved.
I was thinking about some of those case studies that you talked about earlier, Tiffany. Thinking about how did it get to $4.1 million being embezzled? Likely, if an employer had a problem gambling in the workplace policy, that some of these conversations may have taken place. There might have been some warning signs that people picked up on, and maybe there were warning signs that people picked up on, but nobody knew it was a big deal. They because they weren't having that conversation. So again, it's about not getting people in trouble, right? But getting people the help that they need to prevent problems. Not only to the company, but to your employees as well.
Absolutely. Thank you. And those are not easy conversations. When we're talking about somebody's personal life, that can be really hard. And we really want everyone to know that we're supporting the whole process, and that technical support includes those hard conversations. So here's a sample of, what the policy template looks like. We do have a couple others that other organizations and businesses have used that could also be provided. This is starting the kind of having the conversation and what all is included in the toolkit, and just kind of other information that can be used through your company newsletters or other communications that you give out. Back in the day, we used to have paycheck flyers that you can put in with your paycheck. That's kind of past, but there are a lot of other ways that businesses can continue to provide education to their employees. The training that we can offer, we can come in and work with your HR. We can come in and work with your whole entire team or your entire business, and any time frame, 30 minutes or longer, where we would kind of talk about gambling. Why is your business developing this policy? Why are we doing this type of work? Also, this could be provided to HR, which would encourage them to, again, talk to the employees about why this is happening, and who in the community is your resources. Here are two of the posters that are included in the toolkit. These are able to use wherever, and we can provide multiple of them if you need it. And it's just really kind of giving some information and some statistics about gambling in our area. And they are Iowa specific statistics. These are a little bit longer. The one talks about, it's a quick screening. There's a 3-question screening. If the individual answers yes to one of those questions, they could possibly have a problem, and then it would encourage them to speak to a professional about that further. And then the other one is, again, a kind of a longer list of what the warning signs could look like. Heartland Family Service is also able to help with other policies within the workplace. We are able to help with tobacco, nicotine-free workplaces, and that could include reviewing what your policy is to make sure that it is current with trends, which would be specifically vaping trends that we're seeing a lot of in the community, so that your policy is all inclusive and covering all of those things. And there's a lot of benefits to doing that, a lot of health benefits, which also impacts our work quality. And we could provide sample policies on that as well. Drug-free workplace. Heartland Family Service is able to provide training and education around that, as well as reviewing your policy and making sure that it is a strong one. And again, identifying what the resources are, so that when we see somebody at work who is struggling with one of these issues, we know where to help them get the help that they need. If you do have any questions, please feel free to reach out to the Heartland Family Service prevention staff. There is always somebody there who is able to help out, provide more information, provide technical support in any of these areas. And thank you for your time and listening to us today.